Welcome to all viewers and the well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word which you have learned from the word. The motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it is the time to return a lot to the word. The topic which I am going to touch today is the discovery of Dr. Nasser. Since long I have been reading this, it is not always true that you are right and the rest of the world is wrong. But it may be true that you are right and the rest of the world is wrong. And this has led to the greatest discoveries of the world today, which are now considered to be universal truth. This gave me encouragement. Why not? I can do this in my field, which I did in my 35 years of clinical experience. So the discovery of the Dr. Nasser, I have found the different diseases in the clinical practice, which I am going to describe here one by one. These are 7 discoveries by me, and one is the glucopenic headache, tissue paper mania, Piaget syndrome, hypersomatosis, hypophysiosis, new and the novel methods of giving insulin injection to the diabetic patient, and the last is woman lips reality. Today I am going to say something about the glucopenic headache. And glucopenic headache is very commonly seen in the younger patient and the middle-aged patient. And it is a very common disease, but mostly overlooked and ignored. Seen mostly in the young children, more in the female than the males, and more during the fasting and the fasting month of the Ramadan in Muslim countries. It is severe, unbearable headache, mostly felt at the frontal and the temporal region. Sometimes pain is felt behind the eyes. There is no other associated symptoms like vomiting that is seen in some cases of headache. This glucopenic headache is the patient feel exhausted and weakness. There is no relief with a common analgesic which the people do use for headache. No cause can be detected, and some people label it as migraine, but it is different from the migraine, where there are certain associated symptoms which are seen in migraine which are not there. Because no associated symptom as with the migraine are there, it is the diagnosis of the exclusion, the other causes of the headache that have to be excluded to label this glucopenic headache. Now, there are certain types of the headache which are very commonly seen, and that is most of the time the people do suffer, and the clinician do label it as the sinus headache, the cluster headache, the tension headache, and the migraine. As one know that the sinus headache is the pain behind the brow bone, or it is the cheekbone which is involved because there is pus in the sinuses and which is causing the pain. Similarly, the cluster pain is in and around the eyes, as one can see here, and in case of the sinus, where the sinuses are, so the pain will be in the frontal sinus, in maxillary sinus, ethmoid sinus. Tension headache is typical, is like a band squeezing the head, as one can see. It is just in this area, and migraine is usually the one-sided pain. There is the pain, nausea, vomiting, visual changes, and the typical of the classical form, the one half of the head is having the severe pain. The pain is behind the eye, and sometimes this pain is associated with vomiting. So, classification of the headache, International Headache Society have again made this classification, the sinus, cluster, tension and migraine headache. But they have never mentioned this glucopenic headache because this is the first time I am going to make it label that glucopenic headache in my clinical experience. Tension headache, as one can see, it is seen in the area where one can feel the tension, and then refraction of the eye is done so that to rule out the possibility of any eyesight problem that may be causing the pain. If that is okay, so it is not due to the refraction problem of the, one can get the X-ray PNS to rule out the possibility of the sinus headache, and one can see the sinus involved full of pus and the other sinuses. But if these are clear, so there is no sinus headache. People go for the different kind of the test, even the CT scan of the brain, that is just to rule out the possibility of any tumor or anything inside the brain, to see that is causing the pressure on the brain and causing the pain. Sometimes people go for the MRI, and again there is no finding, no positive finding that can be seen in the MRI.